If you have back, butt, or sciatica pain while you're walking and you want to solve it naturally, then in this video I'm going to show you a step-by-step process to eliminate it. So maybe you've been, if you have trouble while walking, diagnosed with spinal stenosis, degenerative disc disease, degenerative joint disease, a herniated disc. Here's the cool thing. It doesn't really matter. I'm going to show you how to solve it. My name is Dr. Charlie Johnson. We're going to dive right into it. So first things first, you have trouble walking. I know you all love my little drawings, okay? I got so excited about shooting this that I had to tape up this strip of paper because we're gonna walk down the whole strip and I'm gonna draw the steps along the way. So you're here because you have trouble walking. Now you may have lumbar spinal stenosis, you may have a disc problem, you may know Arthur, right? Arthritis. It doesn't really matter, you have trouble walking. So now what's cool is that we take your medical diagnosis and we help you translate it into a movement diagnosis. If you have trouble walking, I know without a shadow of doubt, if your pain is due to some type of structural problem in the body, that you will have a yucky back bend. When you stand and when you bend backwards, it will be yucky. Now why? Because as you're walking, what is this? A yucky back bend. And so if we zoom in on the spine, what's happening? This is what's happening. Here's your disc. And you can see right here that this is the arch in the lower back. We zoom in on the bones in the lower back and we blow it up. Then this is going to cause compression of the structures, the joints, and the nerves when you're in that back bend position. So now we took this medical diagnosis. We have trouble walking, but I don't really understand why, Charlie. The reason you have it is because there's something about your body that is probably sensitive to you being in this backwards bent position. Now we just need to solve for it. So now what we're going to do, step one, is we're going to walk you through some basic tweaks for walking. If this is true and you have trouble doing this motion, then what is the opposite of this motion? Well, if this motion's painful, what's the opposite of painful? Pain-free. And what's the opposite of being in a backwards bent direction? A forward bent direction, where we just basically reverse the cubes or the blocks, and now we're not putting stress on the backside of the spine, we're actually creating a gap there. We're relieving pressure on the backside of the spine. So what I want you to do is I want you to do a tummy tuck the next time you walk to prove or disprove. Prove me right or prove me wrong. Here's the cool thing. If you prove me wrong, we'll find another way out of it. Just let me know. Comment below, all right? But if you have trouble walking, and I'm going to exaggerate it, we got a yucky back bend, ouch, because it's closing down on the joints. Well, then how could we remove some of that? Well, we could tuck like this. We could do a little tummy tuck like this. All right, so picture your pelvis as like a bucket of water. Picture you're pouring the water out the back. All right, now you don't need to go extreme. You don't need to do this and walk around like this. You just need to do a little bit of a tuck. Now, if you're not sure how to do that, meaning you don't have the body awareness to do it, what I would do is this. You can pull around here for a sec. I would stand with my feet about a foot or so off the wall. I would put my back against the wall, and you'll see that there's a little hollow there. Maybe you can see it, maybe you can't, but there's a little bit of a gap. Then what I would do is I would aim to tuck and try to move my back flat on the wall or closer to the wall. Now again, it doesn't need to be all the way crunched. Just get it a little bit closer. Even sometimes like a 5 to 10% tuck can be valuable enough and or far enough to remove some of the arch out of the lower back, which is causing you the problem. Then you can hold that position on the wall and you can walk away and maintain it as you walk. All right, so you practice the tummy tuck, little tummy tuck. Okay, I think I'm getting how to do that. All right, and then you can hold it and walk around. Go for a walk and see if it's same, better, or worse. If it's better, in most cases, if you have trouble walking, you will have a yuck back bend. In most cases, it will be better. Then we go to the next step. If it's same or worse, let me know below. That will be a little weird, but let me know, all right? So if better, then not only can you now use this tummy tuck tweak when you're walking so that you can not be picking the scab as much as you're up and about, but it also informs you about what you need to do next. So if you have trouble when you're walking, then either something about the way you're walking, instead of this maybe, could be the problem, or Something about what you're doing before you go for the walk could be setting you up for failure. Here's what you want to think of next. Oftentimes, so step 2, I want you to be mindful of how you're sitting. And oftentimes, because when we have a bad back, we are told to have good posture or to sit up tall, we end up sitting like this, with an arch in the lower back. Most people think sitting is a forward bend. But is it really? It's only a forward bend if you're willing to slouch and be relaxed when you're doing it. If you're sitting like this, then you're arching your lower back again. You're creating a back bend while you're sitting up tall. And so, are you sitting like this or are you not sitting like this? If you're sitting like this in a constant back bend and then you go to stand and walk, well, then you've already pre-positioned yourself in a position which is painful and problematic. You're going to set yourself up for poor walking tolerance. So make sure that when you're sitting, you do that little tummy tuck again. Now here's the cool thing, gravity is going to help you. Allow yourself to slouch. Allow yourself to lean back in the chair and rest your back against the chair. Again, this pre-positions the spine in a forward flex position. To make sure you got it, let me show you here. Most people sit like this because this is what they should do. This is good posture, but that's the yucky back bend. Allow your, again, pelvis is bucket of water. Allow your pelvis to drop backwards and relax against the chair. Try that. The next thing you can do is you can go more to the extreme. Step 3. Cool, let's try it. Now what I want you to do is I want you to sit such that this is really gapped, such that if walking and spending time in this position is yucky, what happens if we spend a bunch of time in this position, not just a little bit, like in this position? So what you can do is while you're sitting, if walking is the problem, you can do this. Take a towel or a couple pillows. You probably need more than one towel. And let's just say you have pain, numbness, tingling going down the left leg or on the left side. Take it and put it under the left side like this or like this. And again, maybe get another one. So this way you're kind of sitting pre-positioned in a knee to chest. And what happens when you pull your knee to your chest? This is what happens. Pull your knee to your chest, it dumps your pelvis backwards. So by putting a pillow or two underneath the back side of your thigh, you're going to pre-position yourself in that backwards tilted or forward bent position. So you're going to be gobbling up a lot of this motion, which is the opposite of that which makes you worse. And then you go walk and you see same, better, or worse. All right? So far we've got 3 possible kind of solutions to trouble while we're walking. Let me get this big chair out of the way. You got the yucky back bend. The yucky back bend shows up in the way you're walking. You tummy tuck. If better, great. We need to consider, are you sitting in a yucky back bend? If so, we need to be slouching or relaxing. And let's go to the extreme of it. Pre-position by putting a towel or a couple pillows under one of the limbs such that we can sit there for a while and see, does that improve the walking or does it not improve the walking? If so, you've already got a couple solutions. Now, what else I would do is all of this that you're seeing so far supports the theory that this backwards arch is the problem and the forward bend is the potential solution. And so now what we want to do is we want to say, how can we take this tweak when we were walking and the tweak that we applied when we were sitting, which again made us feel, in most cases, better, and use that as a clue to inform a movement now that we can use as medicine. Because up to this point, this, step 1, step 2, step 3, this is all subtraction. What I call healing by subtraction. It's optimizing the environment such you're not constantly picking the scab and putting yourself into this yucky back bend position. But now we can start to if this is where you want to go, you want to feel better, you want to heal, you want to be pain-free and happy. Right now what we've done is we put this dude on a diet. There's 2 ways to tip the scale. You can either put this guy or gal on a diet, or you can load up this side of the scale. Right now, we've shrunken this side of the scale. It naturally starts to tip. Now we want to feed this side. So now we heal by addition, by using movement as medicine. Excuse me, ma'am. Movement as medicine. Now, the goal of taking any medicine is never to take more than needed or as much as needed. It's to take as little as you need. It's never to take as much as possible. It's take as little as needed, if any. I think you would agree with me. Well, movement's a pill. So why do a whole sheet of exercise? Instead, why not use all the detective work that led up to this point to now tell you what the motion is? Well, now the tummy tuck in motion form could just be a tummy tuck. You literally could be standing on the wall, doing this tuck, holding 10, 15 seconds, and doing it for, say, 10 reps multiple times a day. So we could just take all of this and tuck away throughout the day, right? Where we do 15 seconds times 5 times 4 reps. Oops, 15 second holds times 5 reps, 4 times a day. And when, think about the timing, this is the dose, this is how much, this is the frequency, how often, and the timing when you're going to do it. You're going to do it before your yucky activity, before you walk. That's one option. Or another way, if you love this, look at this. Look at the shape right here. That's the opposite of what I don't like, which is the banana shape this way, right? Just kind of makes sense. Maybe a tummy tuck. Maybe you just sit and you do this. Here's your chair. Maybe you sit and you bend forward and you palm the floor. And you do 3 times 45-second holds times 5 a day. 45, minute and a half, right? Whatever, a couple minutes of work 5 times a day. And when do you do it? Timing? Before you go for a walk. And this is one motion. And here's how you tell if it's going to work for you. You go back, and instead of doing this and then walking and seeing how it feels, we could do that. But why not make it even easier? What was the motion that was a problem? It was a backwards bend. So don't waste weeks or months doing a bunch of different stuff hoping that it's going to help you. Just prove it right now as you're watching this video. Is this a solution for you or is it not? You should know now, all right? Here's what you're going to do. See how this all connects. You do yucky back bend. There you are. Ouch! How bad is it? 0 to 100. Take a snapshot. 0 is nothing, 100 is the worst ever. Let's just say it's a 50, Charlie. It's a 50 yuckiness. Don't worry about the number. Take a snapshot of how far you can go, what it feels like. Then what I want you to do is I either want you to do the tummy tuck, the TT, or I want you to do the seated forward bend. And I want you to do 3 times 40 seconds. Or I want you to do 15 seconds times 5. Just pick one of them. And then what are you going to do to prove that this thing is valuable for you? You retest your yucky back bend. And if you immediately, upon retest, notice that, Charlie, I did the yucky back bend, it was a 50 out of 100, it was a 5 out of 10. I did this 15 seconds times 5, and then I retested and improved my back bend, bingo, you got it. You bottle that sucker up. You do the 15 seconds times 5, 4 times a day before you walk. That is your prescription. You don't do anything else. You come back, comment underneath this video in 7 days. Can you walk further? Can you walk no further? Or are things worse for some weird reason? These exercises should be pain-free. If you want to get rid of something that's painful, usually doing something that is the opposite and pain-free works a lot better than doing more of that which hurts. If that doesn't work, okay. Do the back bend, do the forward bend, retest. Maybe that cracks the code. And we can just keep trying on all these different motions to see which one works, which ones are going to be a waste of time, and which ones are going to make you worse. That's the process. That's how you fix trouble while walking, back pain, butt pain, leg pain, regardless of what your doctor shows you on the image. Regardless of if you have stenosis, a disc problem, piriformis syndrome, sciatica, a glute tendon problem, a hamstring, whatever it may be. Don't get so caught up in that. Instead, ask yourself, how can I translate this medical diagnosis, which exists outside of me on an image, into something I can better see, feel, and understand? A motion which is yucky, and dang it, I don't need anybody to go ahead and tell me if that's getting better or not. I don't need to wait for another specialist visit to go in and see, is that improving or is it not? You can retest this. And if this back bend improves, once this back bend improves, then you know walking will be pain-free. Because walking is a back bend. Sure, there might be some other yucky motions, a yucky trunk twist, a yucky leg raise if you're walking really fast. But we start by fixing the yucky motions. If pain is of the body, then this yucky motion is showing up in your inability to walk or your inability to stand. And this is the movement pattern or movement pain relationship that we discover. We do detective work to find what changes it. We start to figure out and or analyze how this yucky thing is showing up in your life in different ways you don't know yet. Then we go ahead and we start to unload the yucky side of the scale so that things naturally tip towards healing. We healed by subtraction. Now we can add things on, and only now. Don't start with a bunch of movement as medicine without first figuring out what's lighting the fire. It won't work. Then we go ahead, we test, treat, retest, using everything that we've learned so far to crack the case and solve your problem. All right? Hopefully this was useful. Let me know your thoughts below. Was it helpful? Was it not? Thanks so much. Chat soon.